Hi there, thank you so much for coming to my presentation. Um, my name is Elizabeth Ahrens, and today I am presenting on, just a moment, let me share my screen. Today I am presenting on the effect of mycophenolate on glycophosphorylase. Special thanks to the University of Kansas Department of Biology, as well as my lab partner, Julie Fraley, Dr. Guzman, and my TA, Andrew. All right, so a little bit of background on this enzyme. Glycogen phosphorylase is responsible and is known for being responsible for the breakdown of glycogen, which is what we have as food storage in our individual cells, specifically in our liver as well. And so what glycogen phosphorylase B is, it's the less active version of that enzyme. And so for this experiment, what we wanted to do was study this reverse reaction right here. And so, as you can see, this is glycogen adding glycogen 1 phosphate to glycogen and leaving an inorganic phosphate aside. And so that was what we were able to measure in this experiment, inorganic phosphate, as you will see in later graphs. And so what glycogen phosphorylase is known for is has many different effectors, activators, and inhibitors. And so what I wanted to know was whether mycophenolate will have an effect on this enzyme. Mycophenolate is an autoimmune drug, a drug which many patients are dependent on, specifically when receiving organ transplants or when having an autoimmune disease. This helps suppress the B cells and T cells of the innate immune system. And oftentimes it's not a choice whether a patient is going to take it, it's just whether how much. And so this affects a really great number of people. And so I wanted to understand it better. We use enzyme kinetic assays to investigate this, as well as viewing our results via UV-Vis spectrophotometry. And so here is the glycogen phosphorylase enzyme, seen here with the sugar in its active site, as well as a AMP, adenosine monophosphate, which we will see later, that works as an activator. As you can see, here is the structure of mycophenolate. So as I aforementioned, the purpose of this is to further investigate whether mycophenolate could have a role in glycogen phosphorylase, how this could affect patients, and promote further investigation in the future. And so to start off, we wanted to understand the relationship between absorbance and inorganic phosphate concentration. We want to create this generative curve to create this slope to so that we could use this to interpret our data in these further experiments. And so, as you can see here, these are measured based on concentration and not absorbance. So we wouldn't have to further extrapolate that. It's just a direct ratio. And so we first wanted to find out the effect of an activator on on glycogen phosphorylase. And so AMP is known to activate. And so we achieved this data right here using 5 different concentrations of AMP. And then once we had this data, we went on to the effect of caffeine, which is a known inhibitor of glycogen phosphorylase. And so we use these 4 different concentrations, and so you can see kind of got some mixed data here, but both of these data combined really help. We're going to help us with understanding mycophenolate, which we really didn't know whether it was going to inhibit, activate, or do anything at all. Thankfully, it seems like we got some pretty clear data. The 2 highest concentrations of mycophenolate, as you can see here, are highest in this graph with the highest velocity for this concentration that we were measuring. And so what it seemed to us is that mycophenolate is an activator of glycogen phosphorylase via this investigation that we've done. This could be really impactful for patients, considering that glycogen breakdown or synthesis does affect someone's holistic body state in general, not just their immune system. And so the possibility that this drug could have an effect on multiple immune systems in one person certainly needs further investigation. I hope to see that in the future. Thank you so much for listening. Again, thank you so much for everyone who made this possible. My TA Andrew, Dr. Guzman, my director, and especially my my friend and lab mate, Julie Fraley. Thank you so much for listening.